Welcome to the HITea with Grace podcast, where we spill the tea on HITea. I'm honored to welcome Pamela Stahl and Dr. Julie Shulz from Avalon Healthcare Solutions. Thanks for joining me today, ladies.
Grace.
So great to have you here. So to start, I'll have each of you share the career paths that brought you to Avalon. So Pamela, let's have you start as the president of the company.
Sure. So thank you for asking. I like to say I have 30 years of healthcare leadership experience, although it's really my whole life. I'm a doctor's kid. My father is retired now, but was a family practice physician with a subspecialty in geriatrics in a small town in Nebraska. So I grew up with our dinner table conversations being about the patients he cared for in that small town. And of course, as his oldest daughter, I still think sorry, Julie, to say this, but I still think he's the best doctor in the entire country. And always was, because he cared so much for his patients. I grew up thinking I was going to be a doctor. And as I did research, cancer research in college and things like that, and then realized, you know what, I just don't think that's what I really want to do. And I ended up going into pharma. My dad recommended to me, I remember saying, Dad, having that hard conversation, I'm sorry, Dad, I don't think I want to be a doctor. And then I don't know what I want to do. And he's like, pharma sales, you'd be great in pharma sales. And I said, well, I don't know what that is. What should I do? And he said, and he told me about it. And I said, what are your favorite companies? And in that time period, it was Merck, Marion, and Merrill Dow. And Merck was America's most admired company. So I said, that's what I want. I'm going for number one. So I started my career in pharma sales, and about half my career is pharma. The other half of my career is payer. So I spent about 12 years at United Healthcare. I spent about 4 years at Anthem, Elevance. I've run a couple health plans. And I've started a couple little companies. And so I've been in big companies, little companies, and I found my way to Avalon. I'll answer one more thing and then I'll stop talking about this. But with Avalon, what drew me here? Well, when I ran the health plans that I ran, lab spend was something that certainly I saw. I noticed in my P&L, I noticed it trending. But it's such a small, it's only, 3 to 5% of total healthcare spending. So it was small, and a lot of it was routine testing. So high volume, low cost. There wasn't a heck of a lot I felt I could do about it. And so I would see the trend and feel like it just kind of is what it is. So when I learned about Avalon and I saw that there was a company that actually built to tackle that problem, I was intrigued, and the rest is history. And now I'm here.
That's awesome. Oh, what an interesting past from pharma to payer to healthcare technology in this wonderful space. It's really awesome to have you here. Can't wait to learn from you. And then Dr. Shulz, I'd love to hear from you a little bit about your career path that brought you to Avalon.
Yeah, absolutely. So I'm a physician by education. I did an MD and MPH at Northwestern, although I then took sort of an unusual turn in that I didn't practice. I went initially into management consulting and have been at a series of healthcare startups throughout my career. Everything that I've worked on has been, especially in the product setting, has been focused on helping physicians do their best to provide quality care to their patients. And so making sure that they're following the guidelines, have the tools they need to provide evidence-based care, and have the tools they need to navigate a very, very complicated care pathway for their patients. And similarly, that's what attracted me to Avalon. As we say, science is our true north. We're really taking the guidelines, the evidence, and applying that to lab care, and not just the going to get the testing itself, also the decision making of which tests are appropriate. How do you interpret the tests? What is the next best action to do based on the lab test results? So really excited to be here to talk to you about that and how we see that changing.
Thank you so much, Dr. Shulz. I appreciate you being on here. So Pam, let's kind of start talking about what the heck is happening in the lab world. We're hearing stories of corruption, mismanagement. How can technology kind of reshape the landscape of lab testing, particularly addressing some of the ethical challenges happening within the industry? We'll just dive right in it.
Here's a simple answer to that very big question, right? But maybe some context. Let's start with some context. So there are 14 billion clinical lab tests performed every single year. 14 billion. If you think about it as a patient, right? Think of a time you went to the doctor that you didn't have lab tests performed, right? Every time you go to the doctor, some lab tests. I don't know, Julie, is it 100% of the time you go to the doctor, you have a lab test?
Almost.
I think that's true. Yeah. So 14 billion lab tests are done every year. And those lab tests drive 70% of clinical decisions. And again, if you think about yourself as a patient, I guess I never really thought about it that way. You go in, you have a urinalysis, you have your blood drawn, and you know your doctor's using them. But when you think about how critically important the results and management of those tests are in terms of your health, well-being, and outcomes, I guess most people don't really put that importance on it because that's such a routine thing that you do. So given that the volume is so high and it's happened so much, so what's going on in the landscape? Well, 85% of the tests are repeated after normal results. So that means, clinicians aren't quite sure how to interpret what they did, so they get redone. The waste caused by something called panel stuffing it has an impact of $2 PMPM, which is significant. So what is panel stuffing? Well, if you think about, the marketplace for other goods that you buy, whether it be cans of soda or popcorn or whatever, if you go in, instead of buy one, you can buy 10 and the cost is impact. You can buy 10 and maybe get a little bit of a discount or whatever. In labs, they do something called panel stuffing where you might need 5 lab tests, but they're going to package that with 15 other tests and charge for the other 15 tests. So before you know it, there were 20 tests done on your blood sample, 15 of which you didn't need, nor did the doctor even realize that they ordered. And guess what? That cost is passed through the system and charged. So that's happening. In addition, look, lab testing, we all know, was so critically important during COVID, right? Thank God for lab testing. But what happened during that time period is all these independent labs, all these labs sprung up to meet the need and take advantage of that opportunity, all mostly hopefully good. Well, now we've got this glut of labs out there that are all set up and operating and looking for opportunities to drive volume through their businesses. And so now there are just so many labs out there doing tests and way more than needed. So that's what's going on. Oh, and then let me add this too, and Julie, you can speak to this, but you look at the genetic testing space, right? So there's an explosion of genetic tests, 10 new tests. So what's the statistic on that? How many? I think there's 175,000 genetic tests out on the market today with 10 new ones every single day. And there aren't enough CPT codes, which is what doctors use or the providers use to bill for the tests. There aren't enough. The system's not keeping up with that increase in tests. And so therefore, there's not specificity in the coding and therefore not specificity in the payment. And therefore, if not managed, everything gets paid for. And so those genetic tests are important because it's going to lead to better precision medicine, but the payment and management has not kept up.
So basically it's a big mess. You're telling me. Wow. Yeah.
Opportunity for management for sure.
Absolutely. Dr. Shulz, from a medical kind of perspective, how do you see labs contributing to population health initiatives? And once they're managed properly, what role should they be playing in preventative care, and how can management help assist that?
Yeah, well, as Pam mentioned, lab testing drives so much of care, right? Even if it's a small part of spend, and a lot of that is getting wasted. And I think what's also interesting is that lab testing is getting so much more complex. Physicians don't necessarily get training in genetics, for example. And even if they do, the ability to try to keep up with the literature, with the new tests that are being offered and the way to interpret them, you almost need a subspecialty or need to be on your computer every day reading the literature to keep up. And so we really need tools and technology, if you will, that really help provide physicians that clinical decision support of, as I mentioned before, first of all, just picking the right test, but then secondly, interpreting that test. For example, just a common test that I'm sure everyone listening has had before, a comprehensive metabolic panel is going to be a screening test for a lot of things, but one of the things that it screens for is chronic kidney disease. And unfortunately, even though all of us have had this test, we still see that 90% of chronic kidney disease patients are undiagnosed. And that happens because there's multiple results that come back as part of this panel, and physicians don't necessarily key into something that's a little bit off, or they don't necessarily see the trend that is occurring over time. And so this is a great place where technology analytics can help identify these patients and service them, so that then not only can the physician interpret the test and make sure the patient gets appropriately diagnosed, but also the recommendations, the next best action of what to do based on the test can be complicated as well. And so some labs have gotten much better at providing really sophisticated education to clinicians and to patients in the reports to help them in terms of what they're going to be doing next. But again, that's another great place for technology to come in and suggest to the physician, based on the evidence, based on the guidelines, what the next best action should be, whether that's treatment or additional testing.
Really interesting. It's so interesting to think about labs from that perspective of how can they improve care overall, generally, and the general health of populations. Pam, I've heard a lot about price transparency in this space, and I know that you're a huge advocate for that. Can you kind of speak to what can be done to promote some price transparency in lab services so people know what they have to pay and payers know what they have to pay and everybody knows what's being paid?
Yeah, well, so again, let's put some context to that. So I certainly as a consumer didn't know the what's the word I'm looking for? The difference in prices depending on where you go to have your lab test, right? So if you have the same general health panel done at an independent lab, the cost is $27. That same general health panel done in a physician's office is $35. Okay, so $7. I don't know if that's going to matter to some and less to others. If that same test is done as a hospital outpatient lab, it's $157. So 575% more expensive at a hospital outpatient lab versus independent lab. So there is need for price transparency. There's need for people to know what they're paying and for health plans to know. Congress and regulators and consumer groups have been trying for years to get something moving to increase transparency. There was recently a transparency and coverage final rules, a good start, and so that's finally there. I think companies like Avalon, I think, do a good job and are continuing to make sure there's exposure to the difference so that people know. I also think health plans and employers are going to have to continue to push. The employers care the most. Providers aren't going to make a change unless they're pushed by the people who are actually paying them to deliver the service. So I think it's all of us together doing what we can to expose the differences in pricing so that people know. And by the way, if you think about like in the drug, on the drug side, health plans put into place tiered pricing for drugs. Now, that at least then as a member, if you have your health insurance card as a member, you at least are aware, you have some idea that you should think about, do I get accept this branded drug versus another drug, because you know that your out-of-pocket cost is going to be different. So there's a lot of conversation about whether that should be happening in the lab space as well.
Interesting. And Dr. Shulz, from the experience of you being in the lab and being a healthcare provider, how can the lab and healthcare provider collaborate more effectively to make sure patients are informed about a cost associated with their lab tests before they're conducted instead of after the fact when they see the bill and are shocked?
Yeah, and unfortunately, there's really very little collaboration at all right now. So this is an area that's just ripe for opportunity. Some of the things that I've seen that work really well, and I should mention, it's not just as simple as communicating the price. Figuring out what the price is and what the patient is actually going to pay is extraordinarily complicated because, first of all, you don't know how much of their deductible they've met. There might be some preventive tests that would not go on, that a patient would have no cost sharing for as a result of it being a preventive test. And so making sure, does that patient meet that criteria? Is it that right test? And then on top of that, a lot of labs offer sliding scales. So for patients who perhaps can't afford the test, they offer a reduced price if they meet certain income thresholds. So if you put all of that together, and it's almost impossible to actually tell a patient how much they need to pay for a test on today, right here. So some of the tools that I've seen that work really, that can help this problem is first having portals where someone can log in and very quickly see if the patient has met their deductible, enter some information, and spit out the price. Great place for technology because it's very cumbersome for an individual to track down all of that information. Secondly, making sure that the providers are collecting the necessary information for patients to meet those sliding scales if necessary. I think that's really, really important, because the last thing we want to do is tell a patient a price, and sometimes folks want to kind of overestimate because they don't want them to be to get a surprise bill. But then what you have happen is that the patient declines testing that they actually need because they're afraid that they can't afford it. And so making sure that you're educating the patient on why this information is important and how you're going to make sure that you're going to get the test for them at an affordable rate. Again, all of these things can be really facilitated by technology, by training and scripting. And I don't know, maybe even there will be something in generative AI that helps educate patients on the pricing and selection of their health tests.
A huge opportunity for tech disruption here, it sounds like. I mean, and really it's going to be a mix of people and systems shifting a little bit to make that shift happen in a place where it really needs to ethically happen, not just, logistically, but in an ethical sense too. Pam, I'd love to hear what you've been hearing in the space about what barriers there are to widespread adoption of price transparency practices like this. What is keeping people back from making these changes, and how can they be overcome?
Yeah, I mean, it's hard because it's a cost center, or it's a revenue center, revenue generating opportunity, right? So, but transparency is absolutely worth pursuing. As a matter of fact, there was a 2022 study in Health Economics Review that concluded that hospital price transparency reduced the price of laboratory and imaging tests, except for office visit services. But why is it happening? Well, hospitals charge more for tests because they have higher overhead and because they can, right? Another contributor is health systems' practice of buying independent physician groups and billing subsequent tests done there, the same as if they were performed at a hospital, and tacking on a facility charge. So physicians in those practices are often instructed by their new owners to keep testing in-house. So, as I talked about before, what can be done about it? I think we've got to keep talking about it. We've got to help consumers be aware and encourage employers and the payers of services to take action.
Do you have anything to add to that, Dr. Shulz? Because I feel like you probably have a lot of feelings on what barriers keep people back from really making changes that need to happen here.
Yeah, that's a great question. When I think about it, I get multiple times a week, I get a phone call from a friend, a colleague, someone I know saying, hey, do I need this test? Do I need this? How do I interpret this? There's clearly just such a huge gap. And so, I don't know that I have that much more, to add to what Pam has said, other than, I think we all feel this and experience it. And we just really need those tools to be able to actually price compare, and not just price compare on the single test, but maybe there's alternative tests that we should be having instead, and understanding kind of the groupings of tests or their clinical utility, and comparing not just what the price is, but what is the test that the patient should actually be having.
Interesting. Pam, what ethical considerations should labs be prioritizing now as they're implementing new technologies and new services in the healthcare sector, as they're hopefully coming into the next generation? That's what we're hoping for, right? The next gen lab. What ethical things should they be considering as they're making these big leaps?
Yeah, I mean, I would hope that these labs, as they are coming up with new tests, and by the way, many labs do this, they absolutely do this, but that they're looking for true labs that will improve the outcomes and care for the people that we all serve, and that you start there. And it isn't bringing additional tests to market where there's already a whole bunch of the same tests. So it's just another test of the same to add into the system, but it's truly they're working to improve care for people. In the genetic space, that they're identifying tests that will enable greater precision. Yeah, you take someone with cancer, right? Let's get better, precise tests that enable people to get on the right chemotherapeutic agent in the beginning, the first time, so that their outcomes are better. And that may be mom and apple pie, but that's what I would hope. I mean, there are so many tests out there and so many tests being developed. I think we all owe it to ourselves, again, as consumers and patients, but also to all the people we serve, that we are endeavoring to improve healthcare over time and not just add to the mix.
Absolutely. Amen to that. I think we all agree with you. Dr. Shulz, I'm wondering, as, somebody that's worked in labs, has this great public health background as a provider by training, how do you envision the future of lab testing evolving to better serve those population health goals that we have and improving the health of communities and also maintaining ethical standards like Pam just mentioned?
Yeah, I think, first of all, we have to just have tremendous empathy for our providers who are at, extraordinary burnout levels and who are expected to do truly heroic things on a daily basis. And so we have to be really thoughtful about how can we support them? How can we help them do what's best for their patients in a way that doesn't create extra work and in a way that that fits more seamlessly into their practice. And so I really see, again, because the explosion of information, the number and types of molecular diagnostic tests is increasing so rapidly, we have to be able to have sort of smart tools, clinical decision support tools for physicians to know exactly what they need to do for their patients. That can also be extending that to the broader team. Physicians don't necessarily have to do everything. Can we include pharmacists, community health workers, other members sort of within the healthcare ecosystem that can help out and help patients get educated about what they need to do. The last thing I would say is a little bit to what Pam was saying, not just adding another Me Too test, but really looking at where those gaps in care are. Where are there gaps in survival? Where are there treatment delays? How can lab testing specifically address some of those outcomes? Not just sort of a technical outcome that you might see in a lab, but how does it actually affect patient-oriented outcomes? At the end of the day is what we're trying to fix. So, really focusing on the right things, the right targets in technology and development. But again, I think there's just such an opportunity for clinical decision support, suggestion aids, and analytics to really help physicians do the best job they can for their patients.
Fascinating. So fascinating. This is a space that I'm so thrilled to be knowing more about. And I'm sure all of our listeners are as well. So thanks to you both. Now let's dive into your personal lives. I'd love to hear a little bit about you as leaders. Pam, let's start with you. What are some habits that you have as a successful leader of Avalon Healthcare Solutions, making big impacts in the lab world now? What are some things that you do on a daily basis to work your best and make a difference? Do you have habits or mantras or things that you do as a leader that keep you on your A game?
So I think of it this way. What would I tell myself? If I could talk to my younger self, what would I tell myself now to do, right? And I don't know if it's a habit or a behavior. Some of these things that have been working for 30 years. So I don't even know what those habits are anymore because it's just what I do. But if I could go back and tell my younger self something, I would say specifically as a woman, but as a woman in healthcare, have confidence, trust yourself, trust your gut. Don't question your competence and speak up, I guess. I think of my younger self always feeling a little bit like I don't know that I don't know if I'm the smartest person in the room. I don't know if my idea is right. And I think I hesitated more than I wish I would have. So I would say be confident, speak up. Better to speak up and be wrong than not speak up at all. And so for all those young girls who are out there starting to build their careers, like my daughter's 28, building her career, that's the thing I tell her all the time. Don't hesitate, speak up. You can always course correct. So that's what I would say.
So encouraging. And it's so true. Why do we do that? When we do have the best ideas, why would we hold back and let somebody else say them first? Dr. Shulz, what about you? What would you tell your younger self if you could kind of think back and say something to them? And do you have any habits or things that you do to keep you on your A game?
Yeah, I think I would certainly, it's something I do today and I had to start doing once I became a mom, was just scheduling and setting time aside for myself. Otherwise, it quickly, between work and other obligations and my daughter, all of a sudden I have just no time left in the day. So I have to do that. And I wish I would have done that, and been more diligent about it when I was younger, rather than just, staying up all hours and working way too much. I think similarly, I think sleep is something that I always protect, and I really try not to let that ever, to get get in the way of things. That's also something I have to schedule time for. But I think also picking up on the theme of confidence. I mean, I think back to there's so many times where I cringe, where I thought I didn't know what I was talking about, and I knew way more about it than anyone else in the room. And so it's hard. I think you can always be confident, always just ask questions if you don't know. Trying to kind of learn as much as you can. And, for example, I think about when I took sort of an untraditional path in medicine, a lot of folks in medical school really didn't understand what I was doing, weren't that supportive. I could have just listened to them. I would have been kind of very unhappy, but I talked to as many people as I could find, as many physicians who had kind of taken this untraditional path. And ultimately, I was like, well, if all these 40 people are saying that this is, worked for them and you can do X, Y, and Z, that ultimately, trumped what, I might have been hearing from the so-called experts in the room. So I think, that confidence is so important, and really kind of just continuing to ask questions and be as smart as you can and do your research, because you probably do know more than most of the people in the room.
Oh, I love that. Such great advice. So Pamela, I'm wondering,
Grace, can I throw in one more thing?
Oh yeah, please do.
Let me think of something else that as I've grown through my career, think about what is enabling a success enabler for me. And a big success enabler for me now is my network. And I would never have, in my younger self, would have appreciated the power of my network now. And there are still people, I mentioned that I started my career at Merck. I have friends from my training class at Merck. One of them I called, he's now the head of oncology at a huge pharma company. And I called him a few weeks ago and connected some Avalon people to him about something that we're doing. And yesterday I talked to him, I leverage my network now. I bet it's almost daily to touch base, identify talent, challenge my thinking, ask about what we're doing here. I mean, it is truly, I am so thankful for the network I've been able to build, both as friends and colleagues, and they provide me significant power. And that's them, not me. So
I'm going to challenge our listeners to reach out to your network this week, set up a call, figure out what can you do to leverage your network better to help you level up to the next part of your career and what you're doing in life. Because I think this is a huge thing that we don't really think about. We have these great social media opportunities on LinkedIn to stay even more connected with our network than ever before. And so what are you doing this week? And what can you do this week to just leverage that network like never before? So to finish our conversation off right, where can our listeners find you online? Pamela, I'll have you start.
Well, so the best place to find me is on LinkedIn. And shoot, you're going to ask me how, just look up Pamela Stahl Avalon, you'll find me. But I am reasonably active on LinkedIn, and that would be the best place.
And Dr. Shulz, what about you?
Yep, the same thing, LinkedIn. And I've another sort of recommendation. I try to really keep that up to date with the positions I'm at, the publications that I participated in, any sort of recent news. So definitely check that out, and you can see some of the work we're doing on chronic kidney disease.
That's perfect. Now, before I forget, did you happen to bring tea with you today? Dr. Shulz, I'd love for you to tell me a story about your mug first.
So this is my dog, Blanche. Unfortunately, she is no longer with us, but a neighbor that we live next to back in Chicago, Blanche and their dog used to play together all of the time. So when we moved out here, she painted these mugs for us, and then also a little kind of dog treat jar. So I'm drinking my coffee. It's still early over here in California in my Blanche mug.
That's so sweet. Oh, what a cute pup. How about you, Pamela? Do you have a mug?
I do. My mug today says happy on it. So I have a set of mugs. So I like variety and change. I love change. I thrive on it. And so I don't like to have the same mug. So I have on my counter a whole bunch of different mugs. And depending on my day, I pick the mug that speaks to me. And today it was like, it's Friday. I'm happy. Here's my happy mug.
That's too good. I just love it. Thanks for sharing that with us, both of you. And thank you so much for joining us today.
Absolutely.
Thank you, Grace.
Thank you.
And thanks to you folks for joining us too. Check out the HITea with Grace podcast for more interviews with esteemed guests like Pam and Dr. Shulz today. Cheers.
Like a Girl Media is more than a media network. It's a community. We want to meet you and amplify your voice and the voices of outstanding women innovating in healthcare. Interested in starting your own podcast or hosting an event near you? Connect with us online or in person. We're here to support and empower you.